I'm Dr. Ranjan Shetty. I head cardiology at SPARSH Infantry Road. I'm also the Group Medical Director for SPARSH Group. Today I'm here to talk about angioplasty. If you look at the growth of cardiology as a field, it's thanks to angioplasty, because in 80s up to 90s, only thing people could do is do an angiogram and send them to either surgery or give just medicine. Obviously, wherever indicated, surgery has a very good role. Medicines are must. But there's a huge set of people who are not getting effective treatment. They are the ones who need angioplasty. Angioplasty now, most of the time, is done through the hand, up to 99% of the case. It's extension of angiogram. It's done through the hand. You pass a small catheter and then you pick up the block, and if there are blocks, you pass a wire in local anesthesia, open the block and put a stent. Most simple angioplasties take 30 minutes. Hospitalization is 1 to 2 days and recovery is rapid. But we need to understand that once the patients have angioplasty, it's important they change their lifestyle and take medicines for lifelong.